Hello, welcome to Image Bearers. My name is Louito Edje. This is episode 45 of season 3. I'm very excited to have a bunch of medical experts. I think that's a technical term, bunch of medical experts on today to really just share about a really, really important topic to, I think, so many of us across the world. So today on the program, we have Dr. Louito Edje. We have Dr. Shami Feinglass. We have Dr. Calvin Johnson. And we also have as co-host today, Dr. Bruce Sainamore and also Dr. Derek Wall. I'm going to go through and read a little bit of the bio for each of them. And I will just say I have pages and pages of bio just from their incredible lives, to this point. And there's definitely more to come. But I wanted to just go ahead and share a few things as we start out. So our first panelist today is Dr. Louito Edje. Dr. Louito Edje was president of her medical school student body at the University of Michigan. In 2012, Dr. Edje was the Ohio Family Physician of the Year. She is currently the Associate Dean of Graduate Medical Education at the University of Cincinnati Medical Center, where she oversees education of over 700 residents and fellows. She has been speaking globally on viruses, variants, and vaccine hesitancy via multiple media platforms as a Moderna trial participant, and we'll get into that today. And growing up, although Louito wanted to be an artist as a child, she became a doctor who practices art on the side. And I think her life is definitely a work of art. Our second panelist today is Dr. Shami Feinglass. She grew up in San Francisco, and her mom helped found the Haydash Ashbury Free Clinic. Shami completed her internal medicine residency at Oregon Health Sciences University and her preventative medicine residency at Emory School of Medicine. At present, Shami is a chief medical officer and vice president at Danaher Diagnostics and Life Sciences, where she is responsible for co-leading the global pandemic response plan across 70,000 associates in her company. Shami has served on a number of panels for the FDA, the Brookings Institute, Pew Charitable Trust, Oxford University, and international registry groups. Shami is also a mother of two and is currently, check this out, a BMX bike racer and is currently a BMX champion for the state of Maryland. She's also a member of the USA BMX World Championship team. She puts her heart into everything she does, that's for sure. Our third panelist today is Dr. Calvin Johnson. He was actually here in Detroit a number of years ago, and I think I knew him a little bit, but I've been getting to know him a lot more just recently. He received his training at both Dartmouth and then at Harvard Medical School. At present, Calvin is a professor of anesthesiology at Cedars-Sinai Medical Centers in Los Angeles. In the national media, Calvin has addressed vaccine hesitancy among pregnant African Americans. He has also discussed how we can increase COVID-19 vaccinations among Black and Latino communities. He is also a sponsor of Black Men in White Coats, which is a documentary designed to help address the low number of Black males in medicine, which is awesome. And in his youth, Calvin was an NCAA basketball player and was the captain of his team and was later voted the most valuable player of the Granite State basketball tournament. So that's awesome. And every time I see him, he's got a different team he's supporting. So I'm not sure. I think maybe today he has his medical regalia on. For a little over a year, many of us have heard conflicting reports from television and social media on the COVID-19 vaccine. And we believe today's discussion can bring some needed clarity. Prayerfully, these brief bios demonstrate that our panelists of medical experts are well equipped to discourse on COVID-19 vaccine. Proverbs 15:22 mentions that with many advisors, our plans will succeed. And we believe we've assembled the very best advisors that can help illuminate the fog surrounding hesitancy about taking the COVID-19 vaccine. So again, thank you so much to the panelists for joining the program.
Pleasure to be here.
Our two co-hosts today are Dr. Bruce Sainamore, who was in Detroit. He is known as the Lion of the Tribe of Judah. He was a song leader, did an awesome job with that song. He is now at Lewis Gale Hospital in Roanoke, Virginia. And then Dr. Derek Wall, who I've got to know recently. He's at Mercy Hospital and Trauma in Janesville, Wisconsin. Thank you also for assisting as co-hosts today. Amen. Derek, you want to take it away?
Sure. Well, it's a pleasure to be here. I'll just say in advance that I happen to be on call at this moment. So if I disappear from the screen, it has nothing to do with what any of you all share, but it just means that I'm called away. So prayerfully, that's not going to happen in the next few minutes. So we wanted to start with, Atoma just touched on in his brief bios, your involvement with the COVID vaccination, but we wanted to ask if you could share in a little bit more detail about your involvement with the vaccine. Maybe we can start with Dr. Edje and go to Dr. Feinglass and then conclude with Dr. Johnson.
You're on mute.
Thank you for having me on the show today. Look forward to hopefully making some strides and getting some folks over the line as far as getting their vaccines. So I'm Louito Edje. I have 3 different perspectives that I bring to the table. I am a Moderna trial participant, and I'm over 200 days into the trial right now. And I got into that primarily because I had a loss in the family. My stepmother passed away suddenly over 8 days. And since the Moderna trial is here at the University of Cincinnati, it was really just across the street, and I went ahead and got involved right away. At that time, we really didn't know whether mRNA vaccine was actually going to work or not, but I felt reading all of the data that it was something that I was willing to go ahead and do. I'm also a family physician, and I see patients from birth all the way through death, and I do that a couple days a week. So I've seen patients go ahead and present with COVID-related symptoms and also taking care of them through their hospitalizations and after they've come out of the hospital as well. And so those are the things that I bring to the table and hopefully be able to enlighten the discussion from those perspectives.
And I'm Shami Feinglass. I'm really thankful to be here tonight with you all. I come to this because a couple different ways. I'm a public health physician by training, but have also spent the last count, it was something over 63 weeks, working with a good friend of mine, educating her family and their extended family about updates in COVID. And we had done it as a weekly piece throughout the pandemic. And that's really given us a sense of community. It's been really important to make sure that messages are getting out appropriately. In addition, I am volunteering to give vaccinations in the state that I'm living in right now in Maryland. And then finally, I work for a company that not only develops tests around COVID, but also develops a lot of the inputs into the vaccine. So making sure that we can get as many shots into arms and get as many people vaccinated is a really important piece of what I do, both in my professional life and in my personal life. So always happy to answer any questions about that. By training, as you heard, I'm an internist and preventionist and have worked in government and in the private sector, and then working through volunteer clinics. But the more conversations we can have globally around vaccination, the better it's going to be. So please take some time to get that shot in your arm.
And hi, I'm Dr. Calvin Johnson, and my wife and I are deacons in the South Bay Church of Christ in Los Angeles. And how I got involved was just at Cedar Sinai in January 2020, there was a call that went out to put together like a Navy SEAL team among anesthesiologists. And my wife and I, we prayed about it because it was a tremendous amount of exposure and risk. And together we came to the conclusion that it was the right thing to do to help humanity and our fellow man. And so as part of the COVID airway and COVID line team, there was 20 of us. I was happening to be on both of the teams, the only one on both of the teams. And we went into intense simulator training in February of how to protect ourselves against this unknown virus. And we just went to battle to try and be the first responders to secure the airway and do things in an emergent fashion that would help create a safer environment for our ICU colleagues that would then be taking care of the patients along with us. So that's kind of a decision that my wife and I made together in terms of, because it meant when I left to go into the battlefield, so to speak, she didn't know if I would come home. I didn't know if I would bring home to her. But our faith in God and our belief that this is what He would like us to do. So that's how we got involved.
Thank you. So we all here on the panel, all of us know that surgeons have a very well-deserved reputation of not knowing very much about medicine outside of their own field, of which I'm definitely guilty. So Dr. Feinglass, I wanted to ask if you could explain in surgeons' terms, layman's terms, what a vaccine is and how they work.
Sure, happy to. And I'm very thankful for all my surgical colleagues, because without you, the surgeries that I've had could not have been done. So vaccine, in very simple terms, when you think of it, especially when we look at the mRNA vaccines, the mRNA tells your body how to make a protein or a piece of protein that then your body has an immune response to. So think of it as the piece that is triggering that immune response. You all have probably heard of an immune response. It's where you're building antibodies. So the whole idea in how you prevent getting a disease that you get an immunization for is that your body builds an immunity against that virus. And it builds that immunity because you've been given a shot in your arm that, in the case of these mRNA vaccines, contains a protein that then stimulates the body to make another piece that your body mounts an immune response to.
Very good, thank you. So one of the things that I struggled with when the vaccines came out is to wonder if they were safe, honestly, because of how quickly they had been developed. We all know in the medication pipeline that it can take years from R&D to trial to market. And so, Dr. Edje, one of the concerns that I had was that this seems very quick, that the vaccine just is out and is being mass produced. Can you explain the process that was used to develop the vaccine and why we think it's safe?
Oh, absolutely. Thank you for that question. So I actually like to use the cake and icing analogy for the answer to the question, did this take too fast of a time to get made? So number one, we know, we have known about coronaviruses for 20 years. And the COVID virus is a member of the coronavirus family. So again, we knew all about coronaviruses for 20 years, and it really wasn't a big step to go the next step, which would be to find out the very infectious portion of the virus, which is the spike protein on the outside. That took 66 days to develop. So we essentially had the full puzzle already built for 20 years. It's like baking the cake for 20 years. And all we had to do was determine the genetic sequence of the spike protein, which is the infectious portion of the virus, and then go ahead and start the clinical trials. And typically what happens with the clinical trials is most vaccine trials take about 5,000 people in the phase 3 portion of it, which in the Moderna trial, we had 30,000 people, so many, many more than we normally would have. In all of the Pfizer trials, we've had over 44,000 in the first stage, and with the younger 12 to 15 year old trial, that's been even more people. So number one, we've had much larger volumes of people involved with the trials. And number two, we already had a whole subset of information coming into the beginning of the pandemic year. Took 66 days to find out the very specific, unique thing that we needed to start making the vaccine. And so really it was a matter of finding the flavor for the icing and then icing the cake at the end. So this was really a 20-year process, not just this past year.
Hey, Bruce.
You're on mute, Bruce.
Mute.
I got ahead of myself. Sorry about that.
Mm-hmm.
So I practice out here in Appalachia, and there are lots and lots of people who are not believers. They don't believe that that this immunization is safe, that the vaccine is safe. And I was wondering if you could adjust that a little bit, Calvin.
Well, I think that when you look at, as Lou has said about just how thoroughly the vaccine has been developed, and it's been over decades, as Lou had mentioned. And if you kind of put it in perspective, let's look at the J&J vaccine with the issue of the blood clots that only occur in patients that have a very rare blood clotting disorder. If we use the car accident analogy, you are about 1,000 to 10,000 more likely to die in a car accident than have the rare blood clot from the J&J vaccine. That's just to get it. You're about 100,000 more times likely to die in a blood clot, in a car accident, than get the blood that have a blood clot, fatal blood clot. That's how rare this is. You've got to have and not everyone, even with the rare blood clotting disorder, gets a blood clot. And so I think with social media in this day and age, bits and pieces of information can be amplified in a way that don't give a true picture. These vaccines have been tested, both Moderna, Pfizer, J&J, and they are the safest vaccines that we have of all of our vaccines in the history of making vaccines. They have been scrutinized, studied, tested more than any other development vaccine that we have. Even the VAERS, which is able to monitor adverse reactions, just with the Moderna, with the J&J, 15 blood clots with nearly 8 million doses. It's like we literally found the needle in the haystack. And so these vaccines are safer than anything else that we've had before.
Excellent.
Oh, I'm sorry to jump in, but also when they paused the rollout of the Johnson & Johnson vaccine, didn't that also show that the system worked, that they actually paused it and didn't just say, oh, well, but can you talk about that a little bit?
That's a great question, Tom, because just the ability to identify 15 adverse events out of 8 million doses shows that the surveillance system that we have in place is better than anytime that we've ever had. And the way that we paused and we looked at it and we studied it shows just how committed the government is to public safety, and that they take everything serious. And it from my perspective, it lends to incredible security in how we develop vaccines and monitor vaccines for adverse reactions.
Are there any other significant reactions that you think maybe we don't know about, or we're not being told about, or anything like that?
No. I mean, the things that we look for initially with any drug administration is, an immediate, what we call anaphylaxis reaction. Okay. And again, we are, when you look at the anaphylaxis with the Pfizer, Moderna, or J&J, it's virtually non-existent. We're talking, we had, I think, maybe 100 cases out of 14 million, 17 million doses. And only, I believe, 2 or 3 of those required ICU. And they all did well. And the reaction occurs within the first 15 minutes. And that's why we monitor patients. So I think that these reactions that people are concerned about, yes, we need to be concerned anytime that drugs are administered. And yet it's been rolled out. It's very safe. It's monitored. And I think that, I won't tell people not to worry, because then you worry. But I think that there should be a security in just how much detail has been placed on these vaccines.
Gotcha.
And just to jump in there as well, being a Moderna trial participant, none of us who got the vaccine in the trial got severe COVID to the point of getting admitted to a hospital or died. So that is out of 30,000 people in our trial that we had. So that's just one thing to note. The other thing is in the immunization development process, between the time that all the data has been brought together by the trial clinical investigators and the time they go ahead and are able to have that evaluated by the FDA for an emergency use authorization, there's usually about a 6-week time period in there, because most adverse events are going to occur in that period of time. And so again, in December, that was what was the lag time between the time that all the data had been summed up as good enough to send to the FDA and the time that the FDA went ahead and took to review and look at that information.
So I'm just going to ask the question that is probably right there in everybody's mind is, how does this not genetically, or how does this not alter your genetics?
I can answer that one.
Please.
So yes, absolutely. So one of the things, and this relates partly to pregnancy, which I think we'll talk about a little bit more. It's a question I get regularly. But basically, if you think about a blueprint to make another Lou, that is coded in our DNA. The DNA is locked in a safety deposit box called the nucleus in each of your cells. And mRNA, which is the transcript or the blueprint to make all the antibodies, does not have access to that lockbox, which is your DNA. And so for that reason, women who are pregnant have been encouraged and are continuing to be encouraged to get vaccinated because it does not affect the fetal DNA and it does not affect the mother's DNA. Also, the antibodies that the mother makes, that army to fight the virus once it does come into the body, if they do get exposed, it crosses over into across the placenta to the child, the fetus, and therefore there is additional protection in that stance. Now, with the Moderna trial, we didn't enroll any pregnant women, but of course, nature happens, and we had women who became pregnant during the trial. We then monitored those women who had become pregnant, and there were no problems at all. Getting pregnant and having COVID is really a very deadly combination, and so absolutely we recommend women getting pregnant, but being vaccinated as well.
Hey Lou, related to that one also is the notion of fertility. So we were talking about it's okay to get the vaccine if you're pregnant. I've gotten some questions about, is fertility going to be impacted if I have this shot, if I get vaccinated against COVID? And there are no data to say that fertility will be impacted. In fact, it's unlikely that it would be impacted. And as you saw in the Moderna trial with your co-trialists who ended up pregnant, there's not an impact on that. So people should not worry that they're going to be infertile if they get a vaccine for COVID.
Excellent. Well, good. I know that's a little off script, but these are kind of the questions I think people want to know about. They want to feel secure about if they're going to get this vaccine, what exactly is it going to do to them? And besides anaphylaxis, what are some of the other ways that people's immune systems have responded to receiving the immunization? Can you talk about that a little bit?
Yeah, absolutely. So when I started in the trial, of course, it was actually what we call a double-blinded trial. So essentially, I was given either placebo or the Moderna vaccine, and I didn't know that in September when I got my first shot. Didn't feel anything, walked in, walked out, no problems. For the second shot, my arm felt like a lead balloon, and I was pretty sure that was not from normal saline. I was pretty sure I'd gotten the real deal. But it wasn't until the 6th of January that I had what we call an unblinding visit, which is an obligation that the trial had to do. Once they found out that the vaccine actually does work and does work very well and saves lives, they were obligated to stop and ask every single 30,000 of us if we wanted to go ahead and find out whether we got the vaccine or whether we got normal saline. And if we did get the vaccine, great, did you want to stay in the trial? If you didn't get the vaccine, do you want to go ahead and get it now? And I think just to dovetail into this real briefly, having an IRB, which is a body that looks at trials and makes sure that there has been all kinds of training for everyone who is involved in administering the trials, and the rules around how trials are run is a very important step that has occurred since Tuskegee and a lot of the egregious experiments that occurred with Black and brown communities in the past that have really fueled some of the vaccine hesitancy. So again, IRBs, the things that made me go ahead and be given a choice of the going ahead and getting the vaccine or not getting the vaccine at the middle of the trial was an important piece to have safety. So anyway, I did find out that I was right. I did actually get it. So
just to jump in, Lou, you had mentioned, I think in the past that there are 5 general responses.
Yes.
Can you share about those?
Absolutely. So the second vaccine administered in a 2-shot series is usually what we call more reactogenic, meaning that your body mounts a more robust immune response. And so I think of the 5 major things that usually occur in that situation: the 2 Fs, fatigue and fever. And I think people have been a little bit concerned about getting that second shot because of time off of work and how's that going to affect me? Is time going to be paid? That kind of thing. The other 2 would be muscle aches and joint aches. And then lastly is a mild headache as potential side effects for most individuals. And again, the second shot tends to be the more reactogenic one.
So I would jump in and say I had every single one of those. And I was reveling in joy because it meant my immune response was working. So remember from the beginning of this, Derek, when you asked me what happens, well, that mRNA spurred that protein to be produced to then mount, look foreign to my body, to then have my antibodies come in and mount an immune response. And that's what I felt. And so I was kind of excited. But I'm also a doctor, so I get excited about those weird things. But I will tell you, even if you don't have those reactions, you are still mounting an immune response. Everybody reacts differently. My 2 children have been vaccinated. They had nothing except a sore arm. My husband got vaccinated, nothing except a sore arm. I used to tease him, like, I think it's because you're Canadian, nothing bothers you. But and I'm the only one that had the 5 major responses, as Lou said.
Just one other thing here as well. I get the question, well, I had COVID already. Didn't my body mount a response? Am I protected? The answer to that is absolutely not. What we have found when we test people who've had COVID is some of them have 0 antibodies. So there's no army that's been made in response. Some of them have, a lot of antibodies that wane in a very short period of time. What we do know about the vaccines is that, and this is why I'm still in the trial and I will be in the trial for a full 25 months, is that they take 8 vials of blood to make sure that my antibodies have stayed very high and very robust. And so the vaccines give you a predictably high immune response as opposed to COVID exposure and getting COVID itself.
Right. That's a great point, Lou. And I'm in the Pfizer Corral study antibody trial as well. And similar to Lou, The antibodies are measured against the vaccine, and to see just how effective it is. And so it's an ongoing thing for, like, as Lou mentioned, about 2 years. And we will just go ahead and everything seems to be working great.
Excellent. So I know myself, I had 12 hours of fine and 12 hours of miserable, then back to normal. So that seemed to be pretty consistent across all of my learners as well.
And you know what? The thing about it is that those side effects tend to last for the same amount of time that mRNA lasts in your bloodstream. So it grades very fast, and it usually stays in for about 2 days maximum. It's like a Snapchat message in your body, enough for your body to go ahead and actually mount a response, and then it's pretty much gone. The other thing is, just real briefly regarding ingredients. So the 3 major ingredients in the mRNA vaccines are just mRNA, which again is a blueprint for how to make one portion of the COVID virus so that the body can mount a response. Number 2, lipid, which is just a little fat bubble, a lipid nanoparticle to secure that mRNA so it doesn't break down and it can get injected into a muscle. And number 3, sugar. So those are the 3 things. There's no preservative.
It sounds like the food groups.
And there's no COVID, I mean, strictly speaking.
Absolutely.
Right.
Absolutely. Yeah. I got, when I was trying to decide to be in the trial, I had just been married. In fact, I hadn't even had my first anniversary. And my husband, who is not a physician, had, pretty much said, as long as you get whatever vaccine that doesn't have any virus in it, and mRNA doesn't have any virus in it at all. So that's completely safe.
Perfect. I'm going to pivot a little bit because there is some concern about, if everyone gets vaccinated and then the virus does what viruses do, which is mutate, is it still going to be effective? And I was wondering if you guys could talk about the variants a little bit and kind of how this plays out against those.
Absolutely.
I think what happens is that with you, go ahead. Go ahead, Lou. No, Lou, go ahead.
Yeah, so a variant, basically, I like to use the changing lock and key example. So if you think about the virus as a lock, and every time it reproduces itself, it has a chance to change that lock just a little bit and change into a variant. You always want to make sure that the key, which would be the vaccine, fits into the lock, even though it started to change. So right now, if you think about the naming of the different variants, the first variant that we had that was fairly predominant was the B.1.1.7, the British, and it came out of Britain. One of the things we've been trying to avoid is actually labeling countries, because that sort of puts their citizens in a bad light and so on. So now we have the Delta variant that actually was the B.1.6.1.7 out of India. And they've changed the names now from the B's to Alpha and all the way through Delta. What we do know right now is the Delta variant, which is the most predominant variant here in the United States, its lock has changed so much, but the key, which would be the vaccines that we have available here in the United States, Moderna, Pfizer, and J&J, all 3 of them fit in that lock and still protect individuals from COVID. So that just talks a little bit about the Delta variant. The Delta variant is more transmissible, meaning it's much easier. It's 5 times more likely to get the COVID disease if you're unvaccinated from the Delta variant. So that's one thing. And it also replicates, it makes more copies of itself much more efficiently and much faster in the upper respiratory tract. So right now we're in sort of a race between the vaccines and the variants. We know that variants and the virus tends to mutate a lot more in unvaccinated populations. So the more people we get vaccinated, the less opportunity that the virus has a chance to change into something where our keys now don't fit in the lock anymore.
Gotcha. And that's a real life possibility if the virus is allowed to roam around unchecked, that eventually it's going to mutate to the point that our immunizations don't work. And then we'll all be starting from scratch at kind of the ground floor again.
Right, and that's why we really want people to get vaccinated now, because you don't want to let that virus have time to mutate. So as Lou described, Delta is 5 times more likely to infect someone and get you very sick if you're not vaccinated. In addition, as you guys had heard earlier, I'm running our pandemic response across the world for our company. So I have a ton of associates in India, and I can tell you firsthand that has ravaged that country. And so we are in a vaccination race right now. Like, shots in arm now will help us, for those of us watching from the US, keep Delta at a low enough level that it eventually goes away. That's our goal.
Excellent. Calvin, did you want to say something about that?
Well, yeah, in terms of if you think about if you're vaccinated, that then when you're infected with the virus, you can kill the virus before it has a chance to mutate or form a what we now have is the Delta. Now, if you're not vaccinated, because the vaccine, the virus has to have a living host to mutate. And if that host doesn't have any protective antibodies, such as from the vaccine, then the virus can go ahead and mutate and form these Delta variants, which become more challenging or can become more challenging. Right now, as Lou and Shami have mentioned, all of the 3 vaccines, they do work on the Delta variant. But we have to be careful because it is a race. It's like survival of the fittest. If we allow the virus to infect those that are not vaccinated, a stronger and stronger variant will emerge. We're seeing a mild upspike here at Cedars-Sinai. In the last couple of weeks, we had 30 cases, Delta variant. Here's the thing. 25 of the 30 were not vaccinated.
Yeah, and nationwide, it's over 99% of those who are sick are not vaccinated.
Yeah, and so it really is important that we get vaccinated to really combat these variants that could develop.
I think one other piece to add on that to what Calvin and Lou said is, again, not only just getting shots in arms, but just people staying vigilant. I know everybody's tired. It's been 18 months. Like, I've been doing this since January 2020 because I had teams in China. So I knew what was coming. It's long. We need resilience. You need to dig down. You need to be resilient. You need to have that faith. We will get through this. But now is critical. We cannot let up.
It is.
We cannot let up.
Yeah, I mean, I've been like last week, the Pappers went back on. I had a critically ill COVID patient that had to take care of. And so, we do not want to go back to where we were in January 21, and certainly not back to 2020. But I've been back taking care of first line COVID patients.
It's so easy to want to get comfortable. I know that now in our hospital, we are even pretty lax about wearing masks at all. And even though we're still supposed to technically find that we're meeting in groups and things like that, and often we're not wearing masks, and that's because the Roanoke itself has a very high immunization rate, and so we have a very low incidence of people having COVID anymore. But we treat a lot of people from outlying areas, and those are the ones that have lots and lots of COVID. And I was wondering if you could talk about that a little bit, about what groups are not being immunized, and why exactly are they not? Aren't they not getting a shot? What stops people from wanting to do that? And maybe Shami, you could start that one off.
Sure. Because I wanted to be as prepared as Lou and Calvin always are on these, I have my stats in front of me. So
they are superb stats, by the way.
Based on a data poll of about a week ago for the U.S., by race, the percentage of people fully vaccinated in the Black community in the U.S. is 8.9%. So figure 9% of all the Black population in the U.S. has been vaccinated. 6% of the Asian population, 15% of the Hispanic Latino population, 60% of the white population. We have an equity issue here. Different people are not getting vaccinated at a rate that we really need to get everybody protected. So again, Black community, 9% vaccination rate. Asian community, 6%. Hispanic, 15%. The white community, 60%. So.
Oh, and just to that issue, not just hesitancy in the Black community and that disproportionate affecting, but my grandmother is 97. And so after all the 1As, all of the healthcare providers and everything else got vaccinated, she really should have been at the top of the list of people to get vaccinated. So in December, right after her 97th birthday, she should have been able to get in. She was not able to get vaccinated despite my mother having her doctorate and calling every day until February, because people were coming into her community from other ethnicities and taking all the slots. So there is an inequity issue, not just with hesitancy, because we've got people up beyond some of the hesitancy issues, but access was an issue as well.
Do you feel like that's still an issue, or that now there's plenty of vaccines, but there's other issues?
There's plenty of vaccine, but some people can't get it in certain communities. So separate from hesitancy, in separating those, people who want the vaccine either can't get time off work, can't get transportation to where the vaccine's being given. They live in an outlying area where it's just inconvenient to get to it, even if there's a large vaccination drive. In addition, there are still people that aren't sure they're supposed to get it. So again, a little different than hesitancy here. It's that, well, that's for my 97-year-old grandmother, as Lou was saying. That's for all of us doctors on the screen who are seeing patients. Those are for frontline workers. So they don't know that everybody in this country, except for people below the age of 12, because it's not approved yet, absolutely should be vaccinated. And there are a variety of different community action groups that have been working together to get more people vaccinated in outlying areas. So my one call to action on this call, and I hope it helps people figure this out, is if you do not have access to a vaccine right now, call your doctor's office, call a pharmacy near you. You can even look on the CDC or White House websites. They can tell you where to go. There is no American who should not be able to get a shot now.
Wow. Calvin, what are your thoughts on why are they not immunized?
Well, Shami and Lou have really outlined some of the major obstacles, and we have to meet people where they're at in terms of going into the communities, bringing in community leaders. What I've done is approach and the Black and Brown community church leaders and work through them in terms of education, answering questions, figuring out ways for access, and just the logistics of it that Shami and Lou have already alluded to and mentioned. And because, there's it's a potential fear, there's still the issue with Tuskegee, but there's also the things that Shami and Lou have already mentioned about that are prohibitive to access. And it's just going to take getting involved with the community and using the infrastructure of various communities and working through the community leaders to reach that population that is not getting vaccinated like they should.
And just one thing as well, I counted on my CV, this is my 75th event, podcast, interview about COVID since the pandemic started. And the variety of different places that, it's our local radio at noon hour, it's Facebook Live repeat every 2 weeks podcasts. It's things like Shami's doing, with families every weekend. It's multiple conversations over time. And I think stressing, especially to our younger folks who are the ones who are not vaccinated at this point in time, that long COVID is an issue. And we get concerned about this age group are the ones who are taking SATs and ACTs and getting into college, applying for jobs. And when you get long COVID, it's not like the flu. This is a situation where we're actually almost having Alzheimer's-like symptoms that can affect memory long-term. And so this is a big concern. This is some new data that's coming out. So it's not just not dying or not getting hospitalized, it's having long-term effects.
It's that long-term disability. I think the other piece on that, Lou, I'd say is that there were early on in the vaccination rollout, there were a lot of people that were kind of like wait and see, physicians and nurses and other clinicians as well. We are now far enough into it that the wait and see, I hope, are over their hump. Like, many of us are vaccinated, we are fine, and we really are in a race against these variants.
Yes.
Do you think that there's a little bit of a mentality of, because of, herd immunity that everybody's heard about now, maybe I'll just let everyone else get it and I won't get the shot?
Yeah, except we're nowhere near herd immunity. Remember that 60% of people that look like me are vaccinated. To be very clear, 9% of people that look like Lou, Calvin, and Otoma are vaccinated. 6% of the people that look like Derek. So if I'm going to be really blunt on our 6 boxes here, that's problematic. We're not at herd immunity at all yet. Because remember, we don't have the little kids vaccinated yet. So my children are both in high school, they got vaccinated. But our cousins who are under 12 are not vaccinated yet. And they're all going back to school in the fall, where we have flu and COVID. So again, that's why I get a little passionate about this, is I don't want anyone else to die from this. And I don't want anyone else to have long-term side effects or long-term disability who are young from this disease. It's preventable.
Right.
I'm going to ask one more question, then I'm going to hand this over back to Toma, which is, have all of you guys and your families been immunized?
Yes. Yes. And even on a very personal note, I think we may be talking about the issue of pregnancy next, is putting kind of your money where your mouth is and having my pregnant daughter vaccinated.
Nice.
And not me, but her, educating her and her making the choice. So being able to walk through even as a physician with all the knowledge, when it comes to home and family, we all can have doubts. And that's just human nature.
Yeah, we had four deaths. So my stepmom was the first one that got me into the trial. That was the death that catapulted me into that. Then between that, getting in the trial, and the Moderna EUA, we had 3 more deaths. And then nobody else, because everyone else has gotten vaccinated. So it's definitely effective. Of my 700 residents and fellows, we had 52 before the vaccines were available, and we haven't had any since December. Awesome. So again, this is just evidence as well.
Good deal. Excellent. Atoma, I'm going to let you finish this up here.
Yeah, we kind of talked about this a little bit before, but I think also the role of, can I just say, the media and the news that we ingest also plays a role in whether or not we get vaccinated. I don't know if you guys want to cover that very briefly, what you've seen and how you've, I guess, and this leads into the next question, which is a lot of people may not want to get vaccinated for various reasons. And how do you then communicate with them? What's your, I guess, bedside manner? How do you go about that?
I think you have to approach it with respect and patience and understand where the hang up is with somebody getting the vaccine. It's all about the science. And we definitely have to make sure that we're sticking to the science. If you remember, in the beginning, we weren't quite sure whether if you got vaccinated, you could still spread it. You were protected, but could you spread it to anyone else? And people were confused about that. But we were relying on the science. We had to wait for the science to tell us, yes, you are protected. And you are also protected from transmitting that to other people. So again, it's the science that's really important. And there are no microchips in the vaccine. There's no virus in the vaccine. Again, there are three major ingredients: fat, mRNA, and sugar in those mRNA vaccines.
And I would say validate your news sources, right? If you hear
Yes.
something on the news, go back and listen to what the experts are saying. Listen to what Lou's saying. She's done 75 different media events. Calvin's done them. I've done them. Listen to the experts in the field, and then cross-check to reliable sources. Every single one of us listening can actually go to the CDC or the WHO websites, and you will find facts there. You can double check what you're hearing on the news. And trust me, if it sounds weird or too good to be true, that should be the flag for you. You should go check and make sure.
Yeah. And I think one of the first things that I do is I try to ask a person, what's your background and what are you afraid of? Let's forget about getting the vaccine. What about the vaccine? What about what you've heard? So trying to get an understanding of what media they've been exposed to, what friend has told them this, what family member had this disease, and trying to get a feel for where they are at, and then approach their specific circumstance with, like what Shami and Lou said, applying the science to them specifically.
And I will just say this, because Mickey Corbett, she was 34 when she helped make the Moderna vaccine. She was one of the two lead scientists in the Moderna vaccine trial. She is an African-American woman who is brilliant, and she is a Christian, and she is absolutely amazing. And she has science and her religion connected, and there's full harmony between them. So if you have a chance to Google Kizzy Corbett, you can actually hear her. She went back to her church and talked about how, God has blessed her with this ability and this knowledge to be able to go ahead and help form this vaccine. So she is like the nexus of those two things. And I just Google Kizzy Corbett. She's an amazing Christian.
She's completely amazing. I think the other thing to add is just having the conversation. Just be willing to listen and engage in the conversations, whether it's one person, whether it's 10,000 people that you're reaching in that one piece. I think all of us have convinced people to get a vaccine, get a shot, and we've done it in a variety of different ways. So those of you listening in who are working to help get more people vaccinated, keep talking to your communities. Those of you who are listening in who are not sure they want to get a shot yet, go ask any of us on screen or any of your friends who've gotten shots and ask the questions. Ask, am I going to have side effects? Am I going to feel bad? Whatever's bothering you, as Calvin said, whatever you're worried about, ask. Someone has a logical, science-based answer for you that will help allay any fears you have.
Great, Shami. That's right.
Thank you. We do have some questions that came through that we're going to go through and try to get answered. The first one's from me. So I'm playing favoritism since I know the image bearer guy. I'm going to let him have the first one. So we have our vaccine. How long is it good for? When will we need the next one? How is that done? Mine was the Moderna. I think it was a Moderna.
Yeah, so mine was Moderna too. The rest of my family was Pfizer. So right now, we don't know if we're going to need a booster, and in fact, we don't. There's a whole school of thought that's not anticipating a booster. The key is we're going to continue to watch this, and we expect that the vaccine that people have gotten now will last for a period of time. However, the only caveat I give you, it's not even a caveat, it's just many of us have a ton of questions because we're all watching science be made. So again, for the physicians and scientists watching and talking, this is super exciting for us. For the world, it's probably really scary, right? So we own that, and we're trying to communicate better on that. But the key is many people are watching. We're seeing science work. We expect these vaccinations, we expect your immunity to last a while. We're going to be reassessing that over time. Right now, the studies are showing, I mean, Lou, aren't they showing six to 9 months right now, I believe is what I last saw.
So yeah, so a couple of things. One, typically, if you have a robust immunity in the first 4 months after a shot series, like the end of the second shot, then it's most likely you'll have at least about 2 years. And this is why the Moderna trial is actually scheduled to end at the 25-month mark. And that is why I continue to donate 8 vials of blood to have them check my immunity. But we got past the 4-month mark, which again, historically means the immunity is going to last at least that 2-year mark. So
right.
Hopefully.
And as a Pfizer recipient, who's in the Corral study, again, the antibodies are measured and compared against, and as Shami said, we don't have a real firm number. However, we do have some firm numbers on what will happen to you if you don't get the vaccine. So if someone says, is it going to last a year or 2 years? Honestly, I don't know. But we're simultaneously looking at the potential need for booster shots. So we're covering ourselves. But I know for sure some of the risks you will be taking if you choose not to get the vaccine. That data, I know.
And Calvin, related to that, as we had talked about in the beginning when we were addressing variants, the other key here is the more people that take a shot now, that get vaccinated against COVID now, the less likely that immunity, is going to be as much of a concern, right? So because we won't have it in our system. So if you take a minute and think back to polio, which, I wasn't around for the outbreaks. I wasn't born yet. But I know historically, polio was horrible. Mm. There was a vaccine that came in, and then you don't see polio anymore. So there's long-term immunity from it, but there's also it's not circulating. That's what we're trying to get with COVID. More people that get vaccinated means less host, as Calvin had said earlier, for the vaccine to replicate in and then spread. That is all just as important as how long the immunity is from the shot.
Right.
Okay. Thank you. One other question came in was in reference to FDA approval for the vaccine. And I'm jumping into waters I know nothing about, but what's the process as far as that goes?
So we got the EUA, so the Emergency Use Authorization, back in December. We do also know from Kaiser Family Foundation data, which the Kaiser Family Foundation is an excellent resource as well to get your information. They update regularly. We know from them that 32% of people who say they're not going to get vaccinated would get vaccinated if these vaccines were fully FDA approved. So we are hopeful. Shami, I don't know if you wanted to comment a little bit more on the process.
Yeah, so emergency use authorization is just that. We're in a public health emergency. The FDA and Health and Human Services have an ability to scrutinize all the data and give an emergency use authorization. They're not cutting corners. So let's be very clear. They are following the normal process of how you would do the clinical trials around vaccines and how you would seek approval. There are certain administrative pieces that are taken out of the process for emergency use authorization. To be even more confident of what that means, given that some people won't get it until it's fully authorized, all of the data that are being collected in the trials that both Lou and Calvin are in are going to be used in order to get the full authorization, as some people say. And that is fully expected. So for those of you that are concerned that this isn't a real authorization from FDA. That's not true. It is an emergency use authorization. We use this in times of crisis because it allows us administratively to take pieces out. It also does indeed allow us in some cases to do slightly smaller trials, but it adds on these pieces that are going to be used by the manufacturers to file the full filing because they're pulling all the data now. So again, the trials that are lasting 25 months in the case of the Moderna trial that Lou's in, the trial that's lasting about the same time that Calvin's in, all those data are to emphasize even more that this vaccine is safe and effective. So just because it's EUA does not mean it's not approved. It didn't go through a rigorous regulatory process. They were very rigorous.
Okay, thank you. That helps. I have a question here from Miss Alicia Wall. Delta variant says the average person infected with this variant had, I think, 1,000 times more copies of the virus in the respiratory tract than the original strain. Are there numbers on vaccine effectiveness? And I think you kind of cover this, maybe not necessarily numbers, but that the lock and the key, it still works for that. But did you want to address that in any way?
Yeah, so that's exactly right. What you put here in your question, 1,000 times more copies. And again, as I mentioned before, it's easier to transmit it, but it also makes more copies of itself much more rapidly. Delta variant is covered by our vaccines. That's the main thing that you need to know. So it's effective against that.
Okay, we're going to wrap it up. We just have two people to share. I'm going to ask Dr. Derek Wall, put him on the spot here to share a few closing words, and then I'll have Dr. Lou, if you can maybe share a few words also, and we'll wrap it up.
Well, I think one of the blessings, as it were, of being a emergency general surgeon is that the risks associated with having active coronavirus last year really kind of shut everything down, for us. One is that people were not out getting into trouble and getting hurt. That gives us trauma business. And then for reasons that we don't totally understand, diseases like diverticulitis or appendicitis or cholecystitis, which are pretty common for us, were also reduced for reasons that we don't understand. The risk of doing surgery on people with those conditions is magnified by a large factor. And so in a lot of ways, last year we had to sort of alter the way that we practiced. Instead of offering people surgery, which a lot of times is the best thing for them from that strictly the surgical perspective, we couldn't do it because the perioperative risk for somebody that had active coronavirus was just increased the risk of the operation too much to be able to do it. And so now that things seem to have been getting better, people are out getting into trouble and doing things that land them in the trauma center. And people also, for whatever reason, are getting appendicitis and this and that again too. But we can see it, that we're really on the precipice potentially of another wave, and I think it's a shame because of that. And so, like everybody on the panel has said, really encourage people to consider getting the vaccine, consider trying to persuade people around you to get the vaccine. The numbers don't lie, right? We think we're talking. When we are concerned about the tiny risks that are associated with getting the vaccine, we forget that when we get in the car and go to the store, we're taking a risk as well of much higher, in a lot of ways, much higher potential harm to us. And so I'm grateful to have been able to be a part of the panel and hear all of these numbers, all of what you had to say. Completely agree that the argument is made with science and numbers. It's not a political argument. It's not a social argument. It's not really a moral argument. It's purely a scientific argument. And that hopefully should be able to be enough to convince people to really consider it. So I'm grateful to have been a part of this. Thank you so much for your expertise. And Atoma, thank you for organizing this.
Sure. You're a star, man. Wanted to have you on. Dr. Lou.
Yes, thank you, Atoma. Just wanted to remind folks that just one statistic, only 2% of people in Africa have been vaccinated. So, while we are here in the United States, we are significantly privileged to have access to effective life-saving vaccines. And I encourage you, please, to go ahead and have no regrets. I would love to be able to drive the 4 people in my family who passed away to get their vaccines. Please don't have any regrets. And again, this was before the vaccines were available, but don't have any regrets when somebody in your family passes away because you didn't get a vaccine. They are there, they're available. Please make use of them. Thank you, Atoma. Really appreciate you. And it was a pleasure to be with this esteemed company.
Well, I know each of you has a very high hourly rate, so we are not going to go much longer. I appreciate you taking time, even on a weekend. I'm glad that Derek's, back in the day we had beepers. His beeper didn't go off. He was still able to be with us. But again, thank you. No, still got it. Old school. Okay. I want to thank everyone just for their time today, and prayerfully, those watching were able to get something that resonated with them, and they'll decide to go ahead and get vaccinated. Thanks again for your time.